What if I told you that years before someone is diagnosed with type 2 diabetes, their body has already been warning them? Fatigue after meals, stubborn belly fat, cravings that never stop. This is insulin resistance, and the good news? With the right insulin resistance treatment, it can often be reversed. Today, we're breaking down exactly how to do it, step by step. What is insulin resistance? Let's start simple. Insulin is a hormone made by your pancreas. Its job is to move sugar from your bloodstream into your cells so your body can use it for energy. When you develop insulin resistance, your cells stop responding properly to insulin. It's like the key, insulin, no longer fits the lock, your cells. So your body produces more and more insulin, trying to force sugar inside. At first, blood sugar may look normal, but behind the scenes, insulin levels are climbing. Over time, this can lead to weight gain, especially belly fat, fatigue after eating, brain fog, high triglycerides, high blood pressure, eventually type 2 diabetes. According to the Centers for Disease Control and Prevention, millions of adults have pre-diabetes and don't even know it. Here's the truth. Insulin resistance treatment is not about a quick fix. It's about correcting the root cause. Why insulin resistance happens. Insulin resistance doesn't appear overnight. It develops slowly due to chronic high sugar intake, excess refined carbs, constant snacking, poor sleep, stress, physical inactivity, excess body fat, especially around the abdomen. Think of your body like a warehouse. If you keep delivering boxes, glucose, without shipping anything out, burning energy, the warehouse gets overcrowded. Eventually, the workers stop responding. The powerful part? If lifestyle caused it, lifestyle can fix it. The foundation of insulin resistance treatment. Let's break down the most effective, science-backed treatments. 1. Nutrition, the core strategy. If you change nothing else, change this. Your goal is to reduce insulin spikes. That means eliminate sugary drinks, cut refined carbs, white bread, pastries, sweets. Prioritize protein at every meal. Add fiber-rich vegetables. Include healthy fats, olive oil, nuts, avocado. A practical plate looks like 1/2 vegetables, 1/4 protein, 1/4 whole food carbs. Lowering carb load reduces insulin demand. Over time, cells become more sensitive again. Some people benefit from lower carb approaches. Others do well with balanced whole food diets. The key isn't extreme dieting, it's consistency. 2. Strength training, your secret weapon. Muscle is your biggest glucose storage site. The more muscle you have, the better your body handles sugar. When you lift weights or do resistance exercises, your muscles absorb glucose without needing as much insulin. Insulin sensitivity improves. Metabolism increases. Even 3 sessions per week can dramatically improve insulin resistance treatment outcomes. No gym, bodyweight squats, push-ups, resistance bands, they work. Movement is medicine. 3. Walking after meals. This sounds simple because it is. A 10 to 15 minute walk after meals can significantly reduce blood sugar spikes. It helps your muscles use glucose immediately instead of storing it as fat. Small habit, big impact. 4. Weight loss. Even 5 to 10% matters. If someone is overweight, even losing 5 to 10% of body weight can improve insulin sensitivity dramatically. Not 30%, not perfection, just 5 to 10%. That alone can reduce diabetes risk significantly. Sleep and stress, the hidden drivers. Here's what most people ignore. Poor sleep increases insulin resistance. Just 1 week of sleeping 4 to 5 hours per night can reduce insulin sensitivity. Chronic stress raises cortisol. Elevated cortisol increases blood sugar. Higher blood sugar means more insulin. It's a vicious cycle. Prioritize 7 to 9 hours of sleep, a consistent bedtime, limiting screen time before bed, stress management, deep breathing, prayer, journaling, light exercise. Insulin resistance treatment isn't just about food, it's about hormones. Medical treatment options. Lifestyle is first-line treatment, but sometimes medication is needed. The most commonly prescribed medication is metformin. Metformin lowers glucose production in the liver, improves insulin sensitivity, reduces progression to diabetes. It's generally safe and widely used. However, medication alone without lifestyle changes is like bailing water from a leaking boat without fixing the hole. Some people also explore GLP-1 medications, but these should always be discussed with a healthcare professional. Always consult your doctor before starting or stopping any treatment. Supplements, do they work? Let's be honest, most supplements are overrated, but a few show promise. Magnesium, if deficient. Omega-3 fatty acids, berberine in some studies comparable to metformin effects. Still, supplements are secondary. They support treatment, they don't replace it. How long does it take to reverse insulin resistance? This is the question everyone asks. The honest answer, it depends on how long it has been present, body weight, lifestyle consistency, genetics. Some people see improved fasting insulin and blood sugar in as little as 8 to 12 weeks with consistent changes. But this is not a 2-week detox. This is a metabolic reset, and it requires commitment. A real-life scenario. Let's imagine John. He's 35. He feels tired after meals. His waistline has grown. His doctor says his fasting glucose is borderline. Instead of waiting for diabetes, John stops drinking soda, starts walking after dinner, lifts weights 3 times per week, focuses on protein and vegetables, sleeps 7 hours nightly. 3 months later, he loses 6 kilograms. His fasting insulin drops. Energy improves. Cravings decrease. No extreme diet, no starvation, just strategic insulin resistance treatment. This is possible. The biggest mistakes people make. Let's be direct. Waiting until diabetes develops. Doing crash diets. Only focusing on cardio. Ignoring sleep. Expecting medication to do everything. Insulin resistance is silent at first. That doesn't mean it's harmless. Early action is power. The long-term vision. Treating insulin resistance isn't just about preventing diabetes. It reduces risk of heart disease, fatty liver disease, polycystic ovary syndrome, PCOS, cognitive decline. Metabolic health affects everything. When insulin improves, energy stabilizes, hunger normalizes, fat loss becomes easier, mental clarity increases. This is bigger than blood sugar. Your action plan. If you remember nothing else from today, remember this. Insulin resistance treatment works best when you reduce refined carbs and sugar, prioritize protein and fiber, strength train 3 times per week, walk after meals, sleep 7 to 9 hours, manage stress, consult a doctor if medication is needed. Start small. Pick one habit today, not tomorrow, today. If this video helped you understand insulin resistance treatment clearly, share it with someone who needs to hear this before it turns into diabetes. Subscribe to Balanced Motion Health for practical, science-based health education that actually makes sense. And comment below, what is the one change you're committing to this week? Your future metabolic health depends on the decisions you make now. We'll see you in the next video.